Okay, welcome everyone. This is the draft recovery plan town hall for the pandemic recovery funds. My name is Emma Hertz. I work with the Montgomery County Recovery Office. Just a few notes regarding housekeeping for tonight's meeting before we get started officially. One is to please keep yourselves on mute. We have a large audience today and we just want to cut down on background noise. Second is that the meeting is being recorded. During the presentation tonight, if you have any comments or questions, please feel free to add those into the chat. We will be responding in real time as well as consolidating similar questions to answer as part of our question and answer session in the second half of the presentation tonight. We'll also be linking to some documents that you may find helpful, including the draft recovery plan itself, as well as our online submission form, where you can also provide comments on the draft recovery plan. So I will turn it over to Barbara O'Malley, the Deputy Chief Operating Officer of Montgomery County, to kick us off tonight.
Good evening, everyone. And thank you for attending this town hall and for the robust interest and participation in the Pandemic Recovery Fund program. We were so pleased to see all the community involvement and submission for ideas and projects. We know that everyone put a lot of work and heart into these submissions, and it is disappointing for those that were not recommended for funding. We do sincerely appreciate that effort and will continue to work to ensure that funded projects are successful and impactful and continue to engage our new partners. From the start, the county has seen these $161.4 million in Federal American Rescue Plan Act funds as an opportunity and an obligation. We want to expend these federal funds in the spirit and letter of the requirements to provide one-time funding to impactful projects that can support all our residents with particular focus on underserved communities, and to do this in a process that is equitable, transparent, and with intentional community involvement. The county developed a new department, the Recovery Office, specifically to fulfill this task and be purposeful in this work. On behalf of the county, I want to give my sincerest thanks and appreciation for this new department and the dedicated staff that has been developing tools, processes, and communications to develop this plan and ultimately to see that these projects go through and share the impact to our community, all while meeting the requirements of the funding. I also want to thank our community reviewers for all their thoughtful work, our community partners that hosted town halls and community conversations, and the county commissioners for supporting this effort and challenging us to maximize the impact of these funds and giving us the needed resources to do this work. We believe this has been a very successful process and expect to continue to develop and expand our community engagement and other processes for more of the work of the county. Our Recovery Office website is a tremendous resource with the draft plan, supporting documents, FAQs, graphs, charts regarding these funds. This is also where specific feedback on the draft plan will be collected. We are pleased tonight to present this draft plan to the community as it represents the work of so many and reflects the priorities and needs that we have heard from you. There will be an opportunity at the end for some questions. However, if you're an applicant that has received conditional funding or you have not proposed to receive funding, we are not taking questions on specific projects or programs at this time. Again, we thank you for your participation and we look forward to your feedback after this presentation. Thank you, Emma.
Thanks, Barbara. Thank you again, everyone, for joining us tonight. We're going to kind of move into our full agenda now. We have, so just to remind folks a little bit about where we are in the process, we are going to speak a little bit to the Arpa funding process and kind of where we are within that in terms of getting projects actually funded and off the ground. We'll also speak to the public comment period tonight and how over the next couple of weeks, we're soliciting feedback on the plan and what you all can propose there. And we can move on to the next slide, Tom. We will go through the draft recovery plan, of course, and talk through some of the highlights as well as the major categories that are going to be funded. We don't have time to go through every funded project specifically, but we hope to touch on the major categories. And then finally, we will provide ample opportunity for questions and comments at the end, both written comments through our chat as well as comments offered by unmuting. So moving forward, just to remind everyone, the Pandemic Recovery Fund is our local name for funding received through the American Rescue Plan Act. So you may hear us refer to ARPA, which is the American Rescue Plan Act. That's the original federal legislation that created this fund. The Pandemic Recovery Fund is our local term for that. We conducted an extensive amount of community engagement prior to actually opening up any solicitation for proposals to be funded. Really 10 months of community engagement in which we conducted town halls and surveys and community conversations with different groups. And throughout all that, we were able to establish 2 priorities. The first is around a process itself, with priorities for it being community informed, transparent, equitable, and accessible. And second, around the priorities for the investments themselves. So how the $161.4 million in funding received through Arpa should be spent in the community. And you see those here, that it should really be supporting communities hit hardest by the pandemic and those that have been historically underserved, using funding in a way that's transformative and takes advantage of the one-time and large-scale nature of this funding. That projects respond directly to impacts of the pandemic or issues that were made more severe by the pandemic. And then specifically that we invest in particular issue areas, those being affordable housing, behavioral health, childcare, emergency response, and digital access. In terms of where we are with our process for funding, as mentioned, we had significant community engagement that happened through September 2021 to April 2022 of this year. We then opened up an RFP process where groups, organizations, and individuals could submit proposals for funding. Listening to the community desires around equity and accessibility, the County Recovery Office supported technical assistance so that organizations without as much capacity could have review of budgets and project proposals. We also were allowing submission of projects in the more traditional sense, I would say, with the full budget and clear timelines and milestones, as well as ideas, which allowed for folks to say, I think that this kind of issue or this category should be impacted, but I myself don't have a project to fund through that. Through that process, we received 426 submissions, totaling over $1.3 billion. Then we moved into our draft plan assembly in May of this year. That included a 2-part process. First was we had an external review committee composed of members of the public who represented targeted populations that we were hoping to impact through this funding. And we had 30 reviewers on that committee. They scored proposals based on the scoring rubric that we had established from the beginning of the process. That rubric itself prioritized the categories that we mentioned before, as well as the transformative nature and other local community priorities that we had established. Then the Recovery Office took those proposals and those scores. We reviewed the top scoring proposals and went through again to look at kind of the overall funding picture to determine, of what we are able to fund of this $1.3 billion, do these projects represent true transformation or transformative potential? Are they representative of different geographies across the county? Are we impacting different populations in the way that we believe the county wants us to be impacting them? Are we responding to the needs presented by the pandemic and the impact on different services and supports as a result of that? Through that process, we were then able to compile the draft recovery plan, which is what we're all here discussing tonight. So here we are in the process where we're receiving public comment on that draft recovery plan. Concurrently, we are also, just one back, sorry, Tom. Concurrently, we are also discussing with applicants about their conditional acceptance and ensuring that projects that were funded below the budgeted amount are still able to move forward and making any final adjustments there. And of course, receiving public comment through town halls like tonight, as well as through online submissions that we may receive. We'll be making any adjustments as necessary and then moving to adopt a final plan for funding on August 18th. So regarding public comment on the next slide here, folks have asked us what kinds of public comment would be helpful. What is the purpose of these couple weeks here where we're publishing a draft of a plan before it's actually approved? And really the purpose is to ensure that there's transparency and accountability and that the public has an opportunity to weigh in on this plan and on the decisions that were made before it's officially approved. I think that speaks to the value that we've tried to hold throughout this process around ensuring accountability and accessibility, as well as offers folks the opportunity to provide different kinds of feedback around both the process itself, as well as how well the plan matches their expectations for funding. And then just regarding what are we going to be doing with this feedback, again, making adjustments where it's appropriate, using the feedback that we're receiving to inform future processes and not viewing this as a standalone funding process, but kind of understanding how this can inform how the county does business in other ways. And then of course, identifying future funding opportunities and where the community may want us to invest as a priority area moving forward. So I will at this point turn it over to our recovery officer, Tom Bonner.
Thank you, Emma. As Emma went through, the process has led us to this point, and I'm going to walk through a little bit about the draft recovery plan. The plan itself represents fulfillment of the priorities dictated through our community engagement process and the intent of the American Rescue Plan Act. The magnitude of our submissions was a great problem to have, resulting in the county needing to choose between excellent projects. Emma spoke to you about the process that we use to review, score, and select projects, and the focus that the Recovery Office and the county team exerted on making sure that the projects selected represented truly transformative and opportunities that wouldn't otherwise have been funded through similar programs. In keeping with the required time frame for expenditure of these funds, I also want to emphasize that the county took into account the feasibility of achieving the projects within the 3.5 years that we have available to us. That work, crediting our community partners that created the process and defined our goals, as Emma outlined, the 30 reviewers who worked to review every project, and the Recovery Office staff who directly worked with and in every project and discussed issues and questions at length with submitters across the county, created the draft plan I'm going to briefly walk through today. As it says on your screen, 110 projects have been funded of 426 submitted. All $161.4 million has been allocated directly to projects. As you can see from this graph, all of these items or issue areas that I'm going to walk through individually following this slide. But these are in keeping with the priorities, obviously, that the community has dictated through our process. So I'm not going to read every word on these slides, but this is meant to provide more information to you and mimics what is posted on our website today. In housing, $32.4 million has been allocated given the challenges to housing stability that the pandemic and related economic crisis have taken on homeowners and renters over the past several years. Highlights of this area include construction of 325 new affordable housing units for low and moderate income renters and homeowners. We are seeding $5.5 million in funding for the Housing Opportunity Funds, which is a program managed by a county office, but directly spent on increasing community resources around affordable housing. $500,000 expanding the down payment assistance program. Again, a program managed through a county office, but spent in the community on our residents of Montgomery County. In addition to that, $5.8 million has been allocated to support renovation of existing public and privately owned affordable housing units. And $6.8 million has been allocated for short-term housing for single adults experiencing homelessness, including replacement costs for the county homeless shelter that closed this month. Behavioral health, another express community priority, sees $18.1 million allocated to projects in this issue area. $5 million for school-based behavioral health services, which enables through a program, again, managed through our county behavioral health office in schools. This program will provide eligible school districts throughout Montgomery County access to funds that can be used to hire professional services staff in the behavioral health sense, such as social workers, counselors, and the like. Excuse me, I'm just having a technical problem. This also includes community-based programs and services for child and adolescent art therapy, support services for rural older adults, and counseling services specific to the LGBTQIA+ community, and $5 million for creation for a long sought after behavioral health crisis response center managed by the county, but as a resource for the benefit of behavioral health professionals and clients and residents experiencing mental health issues across the county. Childcare, 9.6 million allocated to projects in the child care issue area, 4 million of it in direct operational support for child care centers through a program that will be a direct aid, meaning that the child care providers will apply through a sub process after this plan is published to gain direct funding, small direct grants to augment their operational costs impacted by the pandemic. I pause on this example because this is one of the items that, as the Recovery Office processed the 426 submissions, this grant program and the need for this became evident. There are multiple providers that submitted operational needs through our process. We are unable to fund all of them, but we wanted to make a meaningful investment across the county in multiple daycare providers to address the issues that were raised through submissions we have, hence this program providing direct support. 3.3 million allocated for new models of child care, including a new in-home model supporting off-hours workers. And then recognizing that the child care space, among others, and this is a common theme throughout the draft recovery plan, to convene stakeholders for further research, to develop cohesive strategies, to engage in strategic planning, making sure that we take into account those idea submissions that said we need to do something, we need to change the way child care industry works. And so we're investing this $500,000, we're allocating this $500,000 for a project that as yet is undetermined, but it is devoted to studying and understanding best practices in the field and professional development and attracting, as it said, qualified workers. $27.9 million has been allocated across community services and facilities, including, oh, I'm sorry, there's an issue here but I can talk through this, we'll correct the slide, including direct support across our communities. We are specifically focused, as I'll talk about it in a little bit, on qualified census tract communities. We are allocating $7 million to invest in Norristown for a community center in recognition, again, of multiple submissions we received, all of them asking for valid, warranted, and appropriate community services to be run by various nonprofits across the community of Norristown. And then at the same time, needing space to do it. And many of them submitted, I need to refit my garage, I need to refit this old building, I have a space in my house, I found this office building. What we are interested in doing in bringing that effort together and allocating funds that can support construction and fit out and planning for a space like that that can serve as a hub for those type of services, recreational spaces included. Additionally, we are funding a $5.5 million investment in a substantial community facility reinvestment in Pottstown managed by the YWCA. Across the rest of that 28 million are community centers specifically devoted to the Latino population in Montgomery County, to the Asian American population in Montgomery County. Those spaces were deemed to be important during the pandemic based on what was needed across the board. And so we're happy to include all of those items, as well as many small projects that represent investment in services. $14.4 million has been allocated to economic and workforce development. This again represents collection of good projects that are ready to go in the workforce development area, making sure that mentoring and job training and job preparedness are part of the work that we're investing in, while at the same time creating programs out of multiple ideas and submissions that we received. And so we're funding small business grants specifically aimed at minority and women-owned business enterprises. We're funding business development efforts across in our qualified census tract areas managed directly by economic development entities in those areas. In the food security space, we've allocated $8.4 million across projects to fundamentally invest in the infrastructure and look towards changing and improving the overall food emergency infrastructure that we have in Montgomery County. $4 million has been allocated to construction and renovation of a food distribution warehouse. $700,000 increasing coordination, improving logistics planning across food pantries, and then establishment of a new food policy council managed initially part of the county with our nonprofit and community partners to make sure that the work on food policy is coordinated, cohesive, and looks towards solving root causes of food insecurity, not just providing, which again, of course, is obviously an emergency at this point. Public health and safety sees $11.3 million invested across multiple projects, supporting emergency medical services, workers training and pay, improving child and maternity health outcomes, assisting firehouses experiencing pandemic-related financial losses. And then again, looking forward, providing resources to analyze, study, and improve the overall emergency services system in the county. In addition to gun and domestic violence mitigation programs and COVID-19 monitoring mitigation strategies. Included throughout this, and we'll see this in a subsequent slide, is allocations to enhance digital access in multiple issue areas. We're also providing $5.1 million in nonprofit and community support, including violence prevention, clothing distribution, immigrant case management services, data resources, and support economically for nonprofits impacted by the pandemic. We're also providing, in keeping with the Arpa legislation, $34.2 million across a variety of government and premium pay services. So as you'll see in subsequent slides, this breakdown accounts for $10 million for county revenue replacement, affecting individually as prescribed in the funding, the replacement of revenue lost during the economic downturn from the pandemic, supporting county operations moving forward. $8.1 million for premium pay for county essential workers. These include workers such as our corrections officers and our public health office employees that were on the front lines of the pandemic, and $6.9 million for essential worker retention and support, reflecting sort of the crisis of hiring that has affected government and private sectors alike. $3 million are included here for lead water piping replacement in Pottstown through the Water Authority and other service improvements. There are obviously a substantial number of projects in this space, and I think, as Barbara and Emma both expressed, one of the challenges we have is that we have multiple great projects and the need to make sure that we're cataloging what we aren't able to fund at this point moving forward. And so I think those projects we will certainly look to fund going forward. I mentioned the words qualified census tract. So the federal funding guidance for the American Rescue Plan Act directs recipients to invest and focus on qualified census tracts in those communities that contain them. We have two. We actually have multiple qualified census tract, 2 cities containing them, one in Norristown and one in Pottstown. We have Tract, and again, I want to be clear about the data that you're seeing here. So this shows that $20 million is explicitly devoted in the project submission to Norristown, and 14 million is devoted explicitly to Pottstown, with $7 million devoted to both Norristown and Pottstown exclusively. This is not to say that other projects in that $121 million that is listing Montgomery County as the affected area won't be even focused on those 2 qualified census tracts. It's a combination of things. 1, that it wasn't identified in the submission, and 2, that it also affects other areas. And so while this does represent a meaningful investment and fulfillment of the directive to focus efforts on those QCTs, it also does not mean that's the only money being spent in those areas. You'll see here what kind of organizations are receiving funds. So this pie chart shows by area which entities are receiving this information, or what kind of organizations are receiving funds. Non-county, meaning outside the county, nonprofit partners, for-profit businesses, community groups, received $81.3 million of this funding, fully representing 50%. Community funding programs managed by the county at $40.1 million, representing 25% of the overall funds, are, again, as it says, spent on community programs managed by county offices, such as our Office of Housing and Community Development, our Office of Public Health, our Office of Behavioral Health. Those programs are spent in the community on services that benefit the community, but they're managed by county departments in conjunction with partnerships across the nonprofit and private sector. 15% of the overall allocation, or $25 million, funds county operations. That's the premium pay, essential worker retention, and revenue replacement that I mentioned before. Again, that's 15.5%. Community-based grant programs at $12.2 million, that represents those programs that I spoke about regarding future investment through small targeted grants for operational support for fire stations, for child care facilities, representing 8%. And then there is a 1.46%, or we're rounding up to 1.5 contingency in here. What we're saying that project management contingency is being held for is to ensure, as is our charge, that all of these 110 projects happen, that they happen within the 3.5 years, and that they represent success on the basis of the projects that were submitted today. And so we wanted this allocation will be reallocated before 2024, which is the requirement under the funding, to projects based on cost overruns. If there are underruns in projects or projects that don't spend the money that's allocated, we will be sure to reallocate those funds within the body of projects we have. I think generally speaking, we would look to repurpose any funds that aren't able to be spent in any project for any reason before the end of that 2024 period. And depending on what that looks like, would be within the existing projects or may represent investment in or further investment in projects that we partially funded. How does the draft plan support priority populations? Again, in keeping with the funding guidance, we are required and embraced enthusiastically the goal to serve underserved communities, both during the pandemic, disproportionately affected by the pandemic, and then historically underserved. And so this chart that you see here represents, again, the data that we have today is based on the submission process. And so when you see that 2% of the projects are devoted to African-American/Black populations, or that 5% are devoted to AAPI populations, or that 5% are devoted to Latino populations, to be clear, what that means is the submitter indicated that for all of the other ones, it was either multiple populations, which is by far most of the projects we received. And so those are currently categorized as general public. As we move through project reporting and execution, we will be developing more granular information as we go. And so those categories, I want to be careful that while it looks like those are the only projects we're funding, it means more so as it's labeled that the rest of the target audience is not known as far as their demographic breakdown. But the majority of them, as you can see from the chart on below, affect not just the general public, but low income sectors of the general public. They affect children and youth, essential workers, homelessness, and those at risk of homelessness. As I said, this is based on our submission process. It's good and valuable data to help inform our process. At the same time, it will be getting more specific as we move along. Does the plan distribute funds to smaller organizations? As Emma spoke about, community feedback established a priority for funding smaller, community-based grassroots organizations that may not have ever been part of a process like this before, whether that means they've never applied for a grant program or whether it means they have never actually come to the county and interacted in any way for services. So as a proxy for indication of this, submitters self-reported their operating budgets. And so of the people that reported their operating budgets, 33 projects funded in our 110, or 30%, are run by organizations with annual budgets under $1 million. Technical assistance to help make this happen, to help engage and as Emma used the words, make accessible the process, was provided to over 400 organizations and individuals. That means the county contracted for technical assistance services. Proposals were developed using that assistance, and we move forward. We also have invested, as I mentioned earlier, special grant program designed for small women and minority-owned businesses. At this point, I'm actually going to turn this back over to Emma to talk through some of the rest of this, and then we'll come back for Q&A.
Thanks, Tom. So to kind of continue the discussion around some of the priorities that have been set for this funding, because of the large scale nature of it, because this funding was able to kind of braid together multiple issue areas, there was a high priority placed on how we can be transformative and impactful with the funding that we have, also recognizing that it's a bit of a sticky wicket and that it's a one-time funding source. So how do we kind of think about long-term impact in that way? And so some of the examples that we wanted to pull out from the funding portfolio at this time that speak to the transformative nature of this are a couple of the investments that we made into community centers and community spaces that Tom spoke about regarding a wellness plaza for Asian American and Pacific Islanders, where that kind of service is really not available in Montgomery County right now. And so a large capital investment at this time can make a momentous impact in that population being able to receive accessible healthcare services. Same for Latinos in Norristown specifically, who have essentially outgrown the community space or one of the community spaces that they're often using. And so this provides for immediate acquisition and construction of a new space to house services specific to that population that have been created by and for that specific population. Other kinds of investments besides capital projects include the Housing Opportunities Fund, which Tom spoke to. And you know, as someone who comes from the housing world, I think this one speaks particularly because it is able to address a lot of the different challenges related to increasing access to affordable housing. One is that there's a lot of unused land in the county that can be bought and then repurposed as affordable housing. And so the fund is going to be able to do that. There are zoning and policy issues that need to be changed or addressed, or kind of systems work through to support greater access to affordable housing in more communities across Montgomery County, so that affordable housing is not concentrated in the communities it is currently concentrated in. And so by investing in a fund like this, that's able to take on this kind of both policy and investment work, we are seeding the future for long-term systems change, which I think is really exciting. And then finally, we also have some other investments into small businesses that we believe are very exciting, specifically in Norristown and Pottstown, and increasing small business assistance and the kind of capacity building supports that many small women and minority-owned businesses might need in order to grow, as well as working specifically around high priority career tracks for young people or workers of any age really, and thinking through, you know, what are the high priority careers in Montgomery County and how can we develop specific workforce programs so that folks can enter into those careers, and really thinking long-term about that opportunity for change. So those were a couple of the transformative projects we wanted to highlight. I should say too, we believe many more of the projects would fit that bill, but we just wanted to highlight a couple of you for tonight. We also wanted to speak to how ideas were incorporated into the plan. I think this was a really interesting approach in terms of a funding process, because as mentioned before, we allowed organizations and individuals to submit projects that follow kind of the traditional grant submission process with a budget and a very clear timeline and a very clear scope of work, where the project was likely going to be managed by the entity submitting it. But we also wanted to recognize that for individuals who were deeply connected to their communities, they may have a great idea that they themselves did not have the capacity to execute. And so through the idea submission process, we were able to solicit those kinds of ideas. And that directly led to the creation of the Child Care Workforce Initiative, where we're investing that $500,000 in bringing together stakeholders who are invested in the childcare space to think about what are the issues related to retention and hiring and workforce development that that really impact every single childcare center and every parent of young children, I would add as well. And how do we think about creating systemic change around that in terms of policy and practice? Could this lead to potential pilot projects that could be funded through future iterations, things like that? So I think that's a really interesting project that came directly as a result of the ideas submitted. Another is related to the Asian American Pacific Islander needs, where we received an idea submission urging us to conduct more needs around the Asian American Pacific Islander communities, recognizing that while there are community needs assessments that have been conducted, in particular by hospitals, those have largely left out the inclusion of voices of Asian Americans and Pacific Islanders in Montgomery County. And more work needs to be done to understand what their specific needs are. And so through that idea, we were able to set aside funding for a project that would connect that and also speak to some of the projects that we received that we were not able to fund from that community as well. So speaking of other funding, kind of looking ahead, we recognize that unfortunately, simply because of the sheer number of submissions and dollar value of the submissions received, we were not able to fund all projects. And again, not that they were, these projects are impactful, they're valuable. I think that many of the decisions were incredibly difficult and we would have loved to fund every single one if we could. And so that being said, we are intent upon finding other sources of funding and thinking about how we use this inventory of transformative projects in Montgomery County and connect that to future funding opportunities. There are additional funding sources coming through the American Rescue Plan Act at the state level, There's other funding coming in, both through the state and federal sources, I should say. Obviously, the county has its own grant-making programs that are just part of its annual budgeting process. And of course, we have our partners in local philanthropy that are able to connect on this as well. And so over the coming weeks and months, we're going to be working to understand what those opportunities are and figure out mechanisms for connecting projects directly to those opportunities. And here I can also speak to a question that I saw in the chat regarding projects that were funded and projects that were unfunded and how we're thinking about connecting different partners. And I think that's really incredible. And one of the things that is so impactful about the approach that we've taken so far is that there has been a lot of work to try to think about connecting partners within the nonprofit sphere or business sphere and having folks work together on some of these larger scale initiatives. And so as we move forward, we're hoping to use our website, our other communications, our convenings to bring folks together, funded and unfunded, but really folks who are interested in the same issues, and broaden the impact of the work that we're directly funding through this by touching more partners and bringing more people into the fold. And so if you have comment about that or have thoughts about how we can do that well, we would love to hear that from you all. A particular note is that there is a project funded specifically to support that as well through the 3 county collaboratives, TCN, ICN, and the Bucksmont Collaborative, to continue some work that was started during the application period of this grant process to allow for incubation of ideas. And so we're excited to continue that work and provide a convening space for folks through that process as well. So at this point, we will kind of turn to our chat. Eli Gilman, our process manager. Oh.
Sorry, Emma, I just didn't, only because we missed this next slide the last time. I was to go through the next steps, or do you want to save it for the end?
Yeah, we can do that now.
Okay. The only reason I wanted to mention, be sure we got this in, because we do want to have a reserved time for Q&A. It's just that there is, our follow-up steps at this point, and this will obviously publish for everyone's reference, but we have additional town halls like this one that are ongoing over the next few weeks, including in multiple community spaces and languages. We are looking, as Emma said, and to submit comments through this link here, which we'll also place in the chat, your online submission form. And it's genuine about, we want your feedback. We want to understand your thoughts on the plan itself. We'll review that feedback, and then our final plan will be approved on August 18th by the county commissioners at a public meeting. So sorry, back to Q&A.
So Eli Gilman, who's our process manager with the recovery office, will be summarizing the questions before we turn to live Q&A.
Thanks, Emma, and thanks everyone for joining us tonight. We've had a few questions come through on the chat, so I'll go through them. The first question, Tom or Barbara, whoever wants to answer, who is considered an essential worker as part of our premium pay plan?
So I think from our end, and I will let Barbara talk through this a little bit, we, as part of the recovery plan, are sure as far as what is in their funding guidance, what meets definition, what eligible work is, what essential work is. And so our role here was to be sure that submitted projects met that role. I'll certainly let Barbara answer as far as from the county's end, what is defined as that type of worker.
Yes, so the county submitted an application for premium pay, which is recommended for funding for county employees. Regarding the regulations, all county workers are considered eligible. So there's the eligible person and then the eligible work. So all county employees by definition are considered eligible workers because they were required to work and were not subject to any stay-at-home orders. In addition, there is eligible work. So it's work that could not be done remotely, had to do in person, and put people at increased risk of being exposed or getting COVID. So these are not all county offices. We had select offices that met those criteria. These were our public health professionals, our nurses who stood up testing, vaccination, contact tracing, our public safety professionals who handled all the logistics, getting PPE out to communities, handling the incredible volume of calls, our coroner staff who had to handle a literal doubling, unfortunately, of deaths in our county during the pandemic with no additional staff, and literally had to stand up temporary morgue sites throughout the county to handle the volume that they had to deal with. Our correction officers, our youth center, who work 24/7 with individuals, providing them direct care and in an exposed environment. Our OCY and aging protective services staff, they are the ones that go out and investigate abuse and neglect allegations. That work could not stop, did not stop, and had to be in person in people's homes. And then also our security, parks, and custodians who, again, dealt one-on-one with individuals and kept our operations going. So we are, again, put that plan through. We are grateful that it was recommended for full funding. And I do believe there is, additional opportunity with a project that is funded. Yes, so just Tom can speak to that project as well.
Sure, so I think we have other, I think specifically around essential workers and around essential work eligible for that. There were multiple projects and unfortunately we were unable to fund all of them. That said, we did fund specific efforts around the emergency services space, the EMS workers. There's a project, not a premium pay project, but it invests in sort of worker incentives that transform some of that and account for the work that they did, as well as some other ones, in the child care side and behavioral health as well.
Thanks, Tom and Barbara. The next question has to do with the minority and women owned businesses. And the commenter asked, does the funding follow the White House guidance on encouraging the use of minority and women owned businesses? And also through the organizations who we funded, do they have a requirement to use local minority and women owned businesses?
So I think generally this is a great question. And anyone can certainly interrupt me, but I think to be sure, our role and our charge, which we have followed, is to make sure that we are using the guidance as part of this legislation. Yes, of course, that the White House is issuing guidance and that there are other initiatives underway, or certainly we know about those and we're certainly happy to see them. At the same time, and I would emphasize this point, that the county as itself embraced the guidance. For instance, and I would say this is unique, at least in my experience, where federal grant funding guidance that emphasizes a lens of equity and how, not just how funds are expended, but also how ideas are collected, a lens of making sure you are led by and serving underserved communities. All of these were at top of mind, not just during our process for intake and submissions, but also as we looked at the projects we had in front of us. And so I think truthfully, the allocation of these funds, just to be perfectly rote, does not necessarily follow because the White House has the objective. However, we as the County of Montgomery in Pennsylvania, the funding guidance as resulting from the state and local fiscal recovery funds, the American Rescue Plan Act, have emphasized this type of work as important and sort of an essential goal of not only this funding, but sort of as we do business going forward. To answer the second part of that question, the recipients don't have a requirement, right? So there's not an explicit requirement. And I guess what I'm trying to say, if I might, is that we have certainly gone above and beyond in this type of program in investing in this specifically. Part of our work is to make sure that we are not just following the guidance, but exemplifying it. And that's what we've done here. So there is no requirement. There's not a requirement in the funding guidance. And the recipients of these grant funds do not have a requirement for that based on the guidance that we have.
Thanks, Tom. We have another question on the Child Care Workforce Transformation Initiative. I believe that's in reference to the $500,000 project that we have looking at the future of the childcare industry. And the commenter wanted to know if the initiative, if we will be reaching out to other areas or whether it'll be completely contained within Montgomery County.
So, and I appreciate that, Eli. I actually read that myself and I would agree. I think I just want to touch on two things just in case. One is the transformation initiative that we've talked about, that Emma, myself, and Barbara talked about, as far as that growing out of an idea, that being a recognition that the industry was uniquely, significantly, and transformatively impacted by the pandemic, and thinking about how to change that going forward has certainly been underway already in our county offices, in nonprofit offices. What we are looking to do there is take advantage of existing best practices, and that could be, I mean, literally anywhere. collecting that information, trying to develop plans for, okay, so if we invest this future round of other funding in this type of program, we would be able to sort of insulate ourselves from potential future pandemics, or literally just improve the services, improve the lives of men and women who have children who need childcare services. And so I think that transformation in this initiative, to use the words that are written in the question, will absolutely reach beyond the boundaries of Montco, because it is designed to collect information and develop plans. And so those people who have employed best practices and new and innovative models will certainly be approached. I also just want to touch, in case you also meant this, there is an operational support grant that we're also talking. That one is for operational support in small amounts directly to Montgomery County child care providers. So those are two different projects related in the same space. I do note that, Emma, you unmuted yourself, so if there's something to say, please go right ahead.
Always something to say about early childhood education. Yeah, I think that's a great question too, around kind of who are we reaching out to when it comes to some of these opportunities that are a little bit more nebulous at this time. So one, I think that by partnering with other counties, we of course open ourselves up to the opportunity for more resources and more transformation, because the more we're able to impact the broader region, the better. And I think too that, some of the work that we have started to do in Montgomery County around incubating new ideas has been done through partners like the Bucksmont Collaborative, which naturally spans both Bucks and Montgomery County. So I think there is opportunity to think beyond just the borders of Montgomery County. Our funding specifically related to operations would be here within childcare centers here, but I think that the impact around policy and design and potentially advocacy is certainly there broader than the county.
Thanks, Emma. That's actually all of the questions that we had in the chat. At this point, we can open it up. Kelly, if you want to ask our participants if they have anything they'd like to add verbally.
Sure. Good evening, everyone. If you would like to ask a question or make a comment verbally, we do have the ability to do that. If you just want to use the raise your hand feature, we can call on you in order. Or if you'd like to just, unmute and make your comment, that's fine as well. So we'll leave a couple minutes to see if anyone else has comments or questions.
We did get one question in the chat. Sorry, Dana, I did see you raise your hand there. We did just get one question about the opportunities for minority women in business, minority and women-owned businesses. How do they connect with those opportunities?
So I think that is a great question, and part of what we are doing now, right? So we, as in the recovery office, enhancing and honing our communications that are on our website and those sort of programs that we have. There are multiple initiatives that are included in this funding plan that we are needing to. We have programs on one-pagers. We are building systems. Actually, you're looking right now at Mr. Gilman, who's responsible for helping to build those sort of processes for bringing in those applicants. And so your question is, to who do we reach out to? We actually will be reaching out to you, and sort of part of our communication effort is to make sure that's not just a thing that's within even the many people who responded through our process, but it's also going out to other members of the community as well. So I suffice it to say, the simplest answer for me to give is that there will be information on our website in the coming weeks. At the same time, we are also pledging to affirmatively reach out across the board to make sure that's a meaningful program. And honestly, that it affects sort of, again, those people that we may or may not have ever had a relationship with before. So, sorry, I didn't mean, there's someone, as Eli said, there was someone who would maybe had their hand up, so I apologize for cutting you off.
Dana?
I was just wanting to sing your praises. I did not get funded, but the whole process was just handled so amazingly well, with such great communication, follow through, integrity. You delivered on everything that you said you were going to do. It just, I really think that you are a role model for how other counties might need to learn how to operate. So I just want to applaud your efforts, because you did not take the path of least resistance or the easy path by any stretch of the imagination. Offering this opportunity out to the community to apply created a boatload of work that you didn't necessarily need to take on. And so I just want you to know that I really appreciate, you know, your transparency and just how you've handled the whole process.
Well, I sincerely appreciate that, Ms. Jackson, and I do want to just use you as an example. I mean, I think yours was a good project that unfortunately did not get funded through this process, but I would emphasize that we, as Emma alluded to, as Barbara alluded to, as we've spoken to through this presentation, we are keeping that in there, and our, you know, our work around other funding, whether it's county or federal or state or other new vehicles, is meant to use the inventory of projects that we have to help move good work forward as quickly as possible. So we will keep that in mind.
Thank you. Thank you, Tom.
Okay, we have a couple other live questions. So Laura Smith, you can go ahead and unmute, ask your question.
Hello, just a quick question. So I'm clearly understand this money is already allocated, and that as of August, I think you said 18th, we're just going to vote on it. So nobody, or you can't have your mind changed to like fund like our public library in the middle of Norristown that obviously needs to be funded, but we're going to create a brand new center and we're not taking care of our local center. So just so I'm clear, we can't get additional money. The money is already accounted for.
So,
am I saying it correctly?
Ms. Smith, I appreciate that question. I think generally speaking, I'm going to answer that a couple different ways. I think first and foremost on the procedure, right? So this money allocated in this draft plan, what we are doing tonight, as Emma walked through, we are introducing this, wanting to collect feedback even right here, but also to collect that feedback through the form that is posted here and just got posted in the chat again. We want your feedback. And so again, I don't mean to put words in your mouth, but as far as building a new center as compared to investing in the library, I think that's exactly the feedback we were looking for. I do want to then speak specifically about the Norristown Initiative, right, that we have heard from the greater Norristown community for across multiple projects that are specifically asking for spaces for community-based services, for assembly space, for recreation space. All of those projects asked for pieces of what ultimately could be a hub type construct, if that makes sense in the public library or in an existing building, such as the Carver Center, such as one of the buildings that is owned by one of the many entities throughout Norristown. The point of our initiative is to use community resources, use the assets that are existing, figure out what the best way forward is and what the most inclusive way forward is. And so I do want to be careful. There is not a thing where that $7 million is allocated specifically is designed to do a new building necessarily. It actually is meant to invest in existing resources, both capitally, meaning equipment, facilities, and human resources, right? Those organizations that are already in the Norristown community doing that work that we heard from. We are going to be reaching out to everyone we heard from and making sure that they're part of the stakeholder group as this space, wherever it winds up being, and it, you know, certainly the library is on the list, as are many other community center type buildings, that they are informing how that building and how that facility gets developed. And so again, I don't mean, as I said, I'm not trying to put words in your mouth, but I think your comment is extremely helpful. And honestly, I mean, I think that's part of the tension that is the reason why we came at this Norristown project the way we have, is to make sure we're hearing from, well, listen, we have this thing right here, or that doesn't work anymore, and I don't want to go. Anyway, all of those facets will be on the table as we embark to this project.
And Tom, I did just want to add to that question for those that aren't aware, and Tom, I know you're intimately aware, the county library in Norristown is a county-owned building. So many of the repairs and investments that need to be done in that building is actually in the county government budget. And we couldn't agree more that that facility is in need of assistance and attention. And we have included a major funds to improvements in that facility and are working with the team and board there on those next steps. So we agree with you on the investment that needs to be made in that facility outside of the Arpa process and project.
Thank you.
Okay, so again, if anyone else has other questions that you'd like to ask, you can use that raise your hand feature or enter them in the chat. Right now, we don't have anyone currently with their hand raised, so I don't know if anything else came through in the chat or. Okay, oh, sorry, Harold, yes, you had your hand raised, go ahead.
Hi, first off, I just want to echo what Dana said about the transparency and the comprehensiveness of this whole process. You guys have obviously put a ton of work into this, and we all really, really appreciate it. I was wondering if you could comment a little bit more on your approach towards emergency services. One of the priorities for this funding was ostensibly to increase healthcare capacity and the ability to respond to future pandemics. I appreciate the $1.5 million set aside for volunteer fire companies, but you know, my feedback would be that you know, that's hardly a transformative approach. Out of 91 volunteer fire companies, 17,000 per company is roughly what any individual fire company is going to spend on electricity and diesel fuel in a year. So I was wondering if you could comment a little bit more on the thought process towards capacity to deal with future pandemics and emergency services in the county in general.
So very much appreciate the question, Harold. I mean, I think, and I appreciate your knowledge across the fire sector in Montgomery County. I think as we got ideas in, and again, I do want to be careful that one of the advantages and disadvantages of the Arpa funding program is that it is a wide variety of intended uses. So one of the other sides of the intended uses is to support impacted nonprofits or institutions that were negatively impacted by the pandemic. As you may know, firehouses are among that group. I think they are also an integral part of our sort of public safety infrastructure here in Montgomery County. And so on one hand, while the $1.5 million, again, that sort of grant program managed in partnership with the Department of Public Safety is meant to augment the impact, or excuse me, to mitigate the impacts of the pandemic financially on firehouses on which the entire county relies on for services. We also have allocated, in keeping with, as you said, sort of that public health preparation for the next pandemic across multiple projects in both the public health and public safety space, and then also in the behavioral health space and in the workforce development space. So there are actually pipeline programs and tuition assistance programs and incubation programs devoted specifically to development of staffing resources in the public health trades. There are investments in emergency medical services, which I touched on earlier, that are included to enhance the efforts and the abilities of our similarly organized EMS services. And then there's actually an initiative not unlike that study initiative that we talked about earlier for childcare, that's meant and is in reaction to some of the submitted projects and some of the submitted ideas to take a look at what the best way to move forward to do exactly what, as you said, and it is a stated objective, is to be prepared for the next pandemic and prepare the public health infrastructure to do so. My response to you is not meant to be argumentative. It's more meant to say that there is a reason, and I think a good one, that's included for the firehouses. And then at the same time, there are multiple other projects across both public health and public safety and behavioral health that address sort of those specific priorities that you mentioned.
Thanks, Tom. I really appreciate the answer. I guess my feedback is really that my concern is that a lot of these funds will be spent in the near future rather than making some sort of focused capital investment where the county would derive a benefit for many years in the future. But again, I appreciate your explanation. Thank you.
Thank you.
Kelly, we do have a couple more questions that came in through the chat and while we were talking. We got another question asking about how minority and women-owned businesses will be contacted by the recovery office. Emma, I don't know if you want to talk about the outreach we've done to local community groups and how we'll be using that to do outreach to these businesses.
Absolutely. So first is that we've already identified some that we believe would be eligible for that grant program. And so if a small minority-owned business applied to this process and was not funded for their project, we also included a note in there saying, we believe that you would qualify for this other grant program and we'll be contacting you directly. So if you got that notice, you wouldn't need to do anything. We'd be reaching out to you proactively. At the same time, we recognize that we may have missed projects that did apply for funding, and that, of course, there are other minority and women-owned businesses across the county that could be eligible for this as well. And so we will be partnering with economic groups in our Commerce Department, chambers of commerce, as well as our community-based organizations to make sure that we're outreaching appropriately and kind of using the same approach of really trying to embed ourselves in the community so that folks are aware of this opportunity and can apply.
And I think that also kind of dovetails with the question that we received about funds that were allocated but not requested in a particular project for a specific community. The commenter asked how we'll be reaching out to experts in that community. And I think hopefully that answers that question as well. We have done a lot of outreach in this process, and we're hopeful that that will continue going forward. And we'll be using those experts to help and leaning on them to help us in those particular communities. We did have one final question asking if any organization that received any EIDL funds will also be receiving these funds through ARPA.
I'm sorry, Eli. The EI. Unfortunately, I'm not precisely familiar with that program. Unless there's other people that are, feel free to jump in. But generally speaking, we both in the process we are now concluding as far as intake and submissions and review, and in the process we are now beginning, which is understanding grant agreements and signing people up for compliance. Understanding is to sort of tease out what types of other funds are available. I will also say that because of the magnitude of submissions and because as a result of that, we have funded many, most projects only partially, that the sort of, we aren't generally funding even most of the asks that we got for our own funding, let alone other funding. So I would answer this a couple of ways. We are checking and have done due diligence as far as what other funding is available to different entities and whether or not that's augmenting these projects. And then at the same time, understanding that we are actually asking people to assemble more funds to execute the projects that we're funding. Oh, thank you. I appreciate the acronym explanation. Sorry, Emma, yeah, you go ahead.
Oh, I just wanted to comment on Peggy's question as well around how are we outreaching to experts as far as some of the unallocated funding or programs where we have, I shouldn't say unallocated projects where we have designated funds for a particular issue but haven't identified a particular partner yet. We'll absolutely be conducting outreach with community experts, again, with known partners in this space, with our nonprofits in the community. But two, I want to emphasize that we're headed into uncharted territory here in the sense that, you know, I think with a lot of typical grant programs, as soon as the funding is announced, that's it, that's the end of the process and the communication stops. And that's not what we hope to have happen here. Rather, we really hope to continue to engage with you all and continue to provide opportunities for folks to work together and kind of connect with different opportunities that are being made available. And so one of the pieces that we'd really like to hear as well through this comment period is how can we best engage with you? Is it through meetings like this? Is it through email communications? Are there other types of structures that would work best? What are your expectations around ongoing communication as we move into the implementation period of this grant program? So we really hope that you provide some of that feedback to us as well and tell us how we can better support this process moving forward.
It looks like we do not have any other live questions and no other chat questions. So I don't know if we want to have our closing comments.
Yeah, simply didn't, you know, anybody else have anything to say, please do. But we really appreciate, I certainly personally appreciate the time you spent with us tonight. We look forward to, you know, ideally your giving us that feedback. In addition to what we heard tonight, we will be sort of cataloging and as Emma outlined, you know, using it to inform not just what happens in the immediate next steps, but also how we move forward on a longer term basis with communication on other initiatives. So that said, really, thank you for the time tonight, and I appreciate everyone's participation. Thank you.